examples in papyrus, old papyrus scrolls in ancient India in 2000 BC or 1000 BC. We find descriptions of operations, the Greeks and the Romans in their writing, we find descriptions of operations and so on. But interestingly, surgery as we know it was done by itinerant practitioners, didn't know anything. And this happened throughout the millennia until the middle of the 19th century.
The Chinese developed acupuncture. The Greeks and Romans used alcohol to not only cleanse the body, they also encouraged the patient to drink the alcohol to the point of being drunk. American Indians relied on the bark of the willow tree, which is a precursor to our modern-day aspirin. One problem associated with surgery was pain.
People would do operations on patients, desperate patients, last-ditch patients. The patients would be held down by rather burly attendants while the procedure went on. It was torture. It was horrible. And if they didn't die during the operation, they died a week or two later of infections.
During operations, the patient would go through so much pain that sometimes they would die of the shock. For anesthetics in the 1700s, most people expected to experience pain in their lives and relied on religion or personal fortitude to help them endure it. Many surgeons often wore the same blood-stained clothing they had used in the previous operations. In the 1840s, Ignaz Semmelweis discovered that he could reduce rates of fever if the surgeons washed their hands. Blood loss began to be solved in the 1900s when Karl Landsteiner discovered the different blood groups.
Well, this has gone a long way now. It started out with kidneys, it then went to livers and hearts and other organs, and now we're transplanting hands, we're transplanting faces. I mean, this is extraordinary stuff for us.
Technological advances have paved the way to the innovational field of surgery, from trepanning skulls with a hammer to guided drills. These advances have led to many medical breakthroughs that have helped us save lives. We now have the technology to perform open heart surgeries, whereas before the 21st century the thought was impossible.
The biggest thing is you may have even seen that we have a little probe that goes on your finger. And this little probe on your finger has two different wavelengths of red light that picks up the oxygen content in your blood. So I can tell how much of your red blood cells are carrying oxygen at any given time. So that one monitor right there has made anesthesia exponentially safer than it was 30 years ago.
This is a procedure used to repair or replace diseased heart valves. Over the past few years, there have been many great advances in the surgical treatment of diseased heart valves. Surgeons are able to repair and replace valves using minimal invasive and robotically assisted techniques. In fact, heart valve surgery is the most common Minimally invasive procedure. This type of surgery reduces blood loss, trauma, and the length of a hospital stay.
It turns out that there are 85,000 elective operations done every weekday in the United States. That's not including emergency work at night or on weekends or on holidays. And this adds up to 20 million elective procedures done per year in this country. And as somebody has put this all together and said that statistically that means that every member of the population, every man, woman, and child in the entire United States will have 12 procedures during his or her lifetime. It's not trivial.
Since 1982, so just the medications that we use for anesthesia are safer. The monitoring that we use to monitor, your vital signs, your oxygenation, all these kind of things is exponentially safer than it was 30 years ago. It's amazing. The incidence of bad things happening under anesthesia is very, very safe now. In fact, it's safer than you guys getting in a car and driving to Sacred Heart today. We've got the robotic surgeries here where you can conceivably have a patient undergoing anesthesia and a surgeon in a different town. And they're actually talking about, gee, what if we have a station on the moon? Could somebody here, a surgeon with a robot, doing surgery here, being performed on a patient somewhere not even on this planet? So those kind of the things are going, wow, that's kind of interesting. But those are things on the horizon.
What is now a simple procedure was a feat back then. Technology is a path to the future of surgery. In the future, more advanced surgeries may be developed, such as small nanotech robots to operate within the body. Surgery is a life-saving innovation that has helped improve life quality in patients throughout the world.
4, 3, 2, 1.